want to address, make a comment about the health of trans youth, reiterating some of what Senator Baldwin mentioned earlier. In the past 6 months, state legislators have passed 75 bills discriminating against LGBTQ Americans and blocking access to gender-affirming care. Drag shows have been attacked, hospitals providing gender-affirming care are receiving bomb threats, and local clinics are installing security systems. Human Rights Campaign declared a national state of emergency for LGBTQ Americans. And the discriminatory actions and statements by elected officials at every level of government are fueling the fire and making the youth mental health crisis worse. Passing bills into law is a tough process. What is easy is giving people the freedom to be themselves. What is easy is not using hate-fueled rhetoric on trans kids to score cheap political points. And we need to do this, especially during Pride Week, to identify this as a huge problem in our country. So I want to turn, to issues that obviously the Surgeon General was addressing, but you're on the front lines. 1 in 3 teenage girls contemplated suicide last year. 1 in 10 teenage girls attempted suicide last year. 1 in 5 LGBTQ youth attempted suicide last year. 1 in 5 LGBTQ youth attempted suicide last year. So this is a real crisis, and we know that it is totally exacerbated by big tech and the role that they're playing in the lives of these children in our country, because it's just unregulated in terms of what it can do to teenagers in our society. No protections, no safeguards. They collect an avalanche of personal information, and they use it up to send back an endless stream of toxic content into the minds of young people in our society. And the results are clear: more money for big tech, more pain for kids and teenagers in our country. And we know that it's Instagram. We know that it's Facebook. We know that it's TikTok. So we have to take action to pass a comprehensive law. We know that it's Disney. We know that it's Paramount. They're collecting information and sending it right back in a form that advances the financial interests of these companies. So my question to you is that Ranking Member Cassidy and I have introduced a piece of legislation that would create an online privacy bill of rights for teenagers in America. There is a law on the books right now for 12 and under, but there's no law for a 13-year-old girl with bulimia or anorexia from being targeted by these companies with information that actually worsen the situation. So here's what the legislation would do. Just love to get your comments on it. 1, the bill would ban targeted ads to children and teens. 2, it would establish a youth marketing and privacy division at the Federal Trade Commission. And 3, it would limit the collection of children and teens' personal information, and it would actually say to parents, you have a right to say to the companies, erase this stuff that you've gathered about my child. Do you think that's necessary? Would you support legislation to accomplish that goal so that the parents and the kids have protections against big tech?
Well, thank you, Senator, for the background and information that you've just shared. And it is so important, I think critically, recognizing the impacts of all of this on our youth, that we're really paying close attention. I really believe hearing the voices, so having youth voices as a part of what is proposed, which is what we try to do in Connecticut, hear from all the voices, including our families, inform ultimately the impact, right, of the proposal being made. And so would really be looking at that very closely to get a sense of all that is being proposed, but anything that we can do.
But in general, do you believe that teens and children need an online privacy bill of rights in our country?
I believe that.
Thank you. Yes, sir.
Thank you, Senator. Yes, I do. I also was struck by the comments earlier this morning, and I don't know if we're using the tools to our advantage. the data would tell us that when kids are talking about suicide, that we could inform them right there online and require companies to give them suicide information. If they're struggling with food, we could require those companies to push that information to them as well, to curb that support as well.
What about upfront, just putting the preventative action in place?
Yes,
So that the kids and the parents have a bill of rights, so that the kid isn't targeted, that exacerbates the situation, so that they do become excessively depressed and contemplate suicide. Do we need those protections put in place?
I have 3 teenagers, and I would say yes, please.
Okay, yes. And Doctor?
Yes, I would agree with my 2 other panelists here. One of the things I was thinking about, but it doesn't in any way negate what I just said, that I agree with it. We also know that for many of these youth, that's how they make relationships too. And so if there was a way that we would be able to help support them in some way at the same time that we're protecting them, I think it would be very important.
Yeah, I would say that we're in a crisis. We hear it today. We know that big tech plays a big role in creating this amongst kids. So we are urgently in need of passing comprehensive legislation. In my opinion, AI that we're discussing right now is just algorithms on steroids. But we already have algorithms on steroids by big companies who target children in our country. We have to put the protections in place. If we can't do that, we're never going to be able to deal with the consequences for AI on steroids. If we can't protect children, we're not going to be able to protect our society. Thank you, Mr. Chairman.
Thank you. Senator Brunn.
Thank you, Mr. Chairman. Senator Kennedy,